I love the water. I love to dive. I wanted to dive for many, many years, and I make a point of getting out whenever I can. But that's something that I look forward to when I get out of treatment, to get back in the water. I'm Andrew. I've been living in Seattle for all my life, and I'm married to a woman named Paola. It's almost 13 years now for us, and we have a daughter named Sophia. She's 6, and a son named Julian. He's almost 3.
When what you're told is less than what you want to know.
When I came out of surgery, I met with an oncologist, and he told me that I had some sort of cancer, and we discussed that specifically I had non-Hodgkin's lymphoma. And when I asked what that meant for me, he was a little bit hesitant to tell me much, and that was a little bit frustrating for me. It's been a bit of a challenge the last 5 years trying to get the type of data that I've been looking for prognosis-wise, where I think I'm getting led down the path of the appropriate treatment, but I still want to have more information about how I fit into the statistics.
It's okay to seek another opinion.
So I've been with an oncologist for about 5 years, and a very nice gentleman who's helped me quite a bit. But in terms of the way he delivers information to me, at times it hasn't been quite what I've been looking for.
Discussing prognosis is hard, even for doctors.
Early in my career, I could see that patients weren't necessarily being told the whole story. I felt like they didn't have a chance to bring their own strengths into the equation. And because of that, I've really wanted to change the paradigm of what we do as physicians when we're with patients.
I remember my first conversation with Dr. Bach, and it was a very, very nice conversation. And I happened to be over at the hospital getting some treatment. He was the attending physician. And I asked him for some information and for some help, and he took the time, he sat down, and he answered my questions in great detail. So at times when I haven't received information from my primary oncologist, I've asked for information from other folks, and luckily I've been able to receive what I've been needing without needing to switch doctors or that type of thing.
You know, I saw doctors who were really kind and well-meaning, who were trying to shield patients from their real situation by giving out only little bits of information and allowing a kind of fiction to go on about how serious their situation was. I felt like that wasn't good preparation. So that's where I feel like the way we communicate with people is part of the treatment that we give and part of the care that we give.
Be clear with your doctor about the information you want.
I think a good idea, if it's possible, is to speak your mind, tell your doctor what you're thinking. Say, this is what I'd like to hear from you. Is this something that you feel you can share with me? If you learn that there's not going to be a fit, then you can ask for assistance in finding someone who would be a better fit.
And I think most doctors, if you give them specific instructions, or if you give them enough guidance about what's working for you or what's not working, they'll do it. I think they're often hesitant to offer too much information because they think it's going to be too much for you. So in a way, you have to tell them, you know what, I can deal with this.
My son still is young enough to not really understand too well. My daughter's old enough that she's concerned, and she just tells me with some regularity that I wish you weren't sick, Papa. But I just tell her I'm taking medicine, and just leave it at that, make it real simple for her. Because I still have a cure right around the corner, so that's what I'm crossing my fingers for. And we leave the discussion at that.
Department of Health and Human Services, USA. National Institutes of Health. National Cancer Institute. www.cancer.gov/prognosis. 1-800-4-CANCER. Produced December 2012.